Good evening, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. I'm Dr. Moby, and today we are honored with great guests all the way from Australia. Let's welcome Aaron. Hi, Aaron.
Hello, thank you for having me.
Okay, thank you for coming all the way from down under.
That's all right. That's all right.
Okay, so tell me about yourself, Aaron. I know you do a lot of coaching. So.
Yeah, so basically, I'm an anxiety coach, mainly for men. I do help females too, and the reason I got into it was a bit of a progression. I was a PT, a personal trainer in Australia, and I fell in love with helping people. Little did I know, deep down, I had these insecurities that I haven't actually worked on myself, and they started to surface, in my 20s, and I didn't know what to do with them. And to cut a long story short, I went to go see a doctor to help me out. I'm feeling a bit anxious. I don't know what to do. I'm feeling a bit depressed, and I went through the system in Australia. I don't know what it's like in America, but I went through the system, the mental health system, and I come out the other side not any better. If anything, a little bit worse, because I didn't feel it helped me at all. So then I went on a bit of a journey to find answers and outside, the medical system and the system in Australia. And I started finding mentors and unorthodox ways of healing anxiety. And I started healing my own anxiety, and it was just a natural progression to go, okay, I've healed my anxiety. I know it works. I believe I know it works, and what doesn't work, here's the way to do it. And that's just how I got into it.
And so, how long ago was there any particular episode or client-wise you were dealing with that kind of motivated you?
To go see the doctor?
No, like to start this journey.
Of helping other people?
Mm-hmm.
Yeah. Well, naturally, I've always been a helper. So I've always been naturally, I'm a helper. I just love helping people. So I went and seen a mentor and did a few lessons from him just to try. He was teaching me how to coach others, and I just loved the thought of being able to help others through what I've been through. So it wasn't really one particular moment. It was a progression.
So, and you said you love behavior health or anxiety, or because you feel closer to that topic.
Yeah.
So, because I think, how did you end up liking that? I mean, a lot of people get like scared with that.
With what? Sorry.
With behavioral health, anxiety, psychology, they find it very difficult. So.
Yeah. Well, I loved. Do you mean how I studied it, or how I went through it?
And no, like you chose that field to help others, right?
Oh yeah. Because deep down it was so close to home. It was just so. I think everyone can relate. You love teaching or helping or guiding others in something that you're really passionate about. Just like yourself, like you're passionate in certain areas, and I found whatever you love learning about most, you love teaching about. That's just I love learn. I still love learning about anxiety, psychology, and anything to do with the mental health. I just love soaking it all in, and then just it's just a natural thing to want to teach it.
Okay. Hey, Aaron, I think your mic is making a little more noise. So if you bring it a little farther.
Is that better?
Yeah. No, this is better. Yeah, probably.
That's better. Oh, sorry. Thank you.
Yeah.
Yeah.
No, I think no. I was saying just maybe lower it, so because it kind of bumps the voice at the end, kind of is bumping a little bit. So
it bumps.
Yeah, like it resonates a little bit. So maybe I thought maybe the mic is too close to your lips, or
too close. I might put it a little bit further then.
Yeah. So
is that better?
Yeah, that's better.
Okay, beautiful.
Yeah. So because it's kind of vibrates a little bit at the end.
Yeah.
Too much gain. So, but I
Yeah.
thought maybe when we are doing podcasts, it will kind of show that. Okay. Anyway, so let's start with some of the things. What is the difference between which you have seen with men dealing with men with anxiety?
Yeah, that's a good question. Because I started off helping females as well, so I grew a large following of females and helped them. There are similarities, and what I've realised is a lot of we call them blokes in Australia, guys, men, are very shut off from their emotions, very shut down, and we tend to wait until we're struggling, like really, really struggling, before we seek help, because seeking help for men is very, very difficult. It's probably the hardest thing a man can do is say, put their hand up and say, I need some help here. So the biggest difference is the willingness of females to reach out and say, hey, I need help. Can you help me? As opposed to men are really hesitant. And I know because I was the same. I waited until rock bottom, until like I knew there was nothing else for me to do but to go seek help.
Yeah.
So that's kind of my fight now, is to go, hey guys, like I understand you may be struggling, but let's not wait until you're absolutely rock bottom until you reach out for help. In fact, it's actually a very strong thing to reach out for help. It's not a weak thing.
Mhm. Yes, and this is very interesting because even in states, when I'm practicing, I see, I used to practice family practice before. We used to have a lot of patients with mood disorder. They'll come and the men will say, they'll never say we are anxious. I mean, really, once they already have diagnosed, but mostly they'll say, I'm mad, I'm upset. So,
Yeah,
and I would
yeah.
say, upset with what? And then they will open up a little bit. Hey, I'm just feeling sad or depressed,
Mm,
but
mm.
just still use the word I'm mad. It's just like.
Yeah, yeah. Well, I think for men, a lot of the times when we were young boys, our aggression was pushed down. So it's don't get angry, don't do this, don't do that. And so we grow up as men not knowing how to. Because the thing is, being mad is not a bad thing. It's only you could call it a bad thing when we're trying to push it down and trying to deny our anger, or our whatever it is. We when we push it down, I believe that's the issue. It's not the issue when it comes up. And I think we've just been conditioned as men to push things down and stuff things down, and that is the issue.
Yeah, yeah, and this is what I've seen mostly. You're right. It is from the earlier training. They will be just try to suppress, and they will keep carrying on. So I used to have a lot of. I dealt with a lot of folks up in the Department of Defense or even Army and veterans too, VA veterans too.
Mm.
And for many years they will be serving, and there will be if you ask them, they say, well, they never took care of themselves, what I mean? So they always kind of sacrifice,
It's
and they
sacrifice.
tough it out. But the problem is it wears them down to.
It wears them down. That's right. Yeah, especially like defense. That's like a perfect example of what happens to men on a extreme case in defense and army and all that. It's be tough, don't show emotions, like have this wall up, like be strong.
Mhm.
And that we're all human, whether you're female or male. We're all human, and we have ups and downs. We have our weaknesses and strengths, and trying to be a one-sided human is going to break any human down. Trying to be strong all the time, or trying to be never show weakness all the time, or never express your anger all the time, or whatever, that's going to break someone down over time. That's just what happens.
Mhm. That is true. So tell me, what are the other risk factors which you have seen with men that kind of predispose somebody to anxiety disorder?
Risk factors
Yeah,
before, as in what do you mean? Sorry.
like there will be more chances that they have mood disorder
Oh,
or anxiety
yeah,
disorder.
yeah, 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 yeah. So, what I've noticed in men, and obviously statistics say, is that
Mm,
obviously there's more suicides with men, because I believe they're holding they suppress it so much when it gets so
Mm-hmm.
overwhelming for them. It's like they don't know what else to do, and they rather literally, take their own life and then reach out and be vulnerable. So the risk factor is men not knowing how to be vulnerable, and it
Mm-hmm.
shows up as severe depression, severe anxiety, severe, you know, um, uh, I just find they find it very hard to open up and be vulnerable, and I think that's the
Mm-hmm.
biggest thing. I think that is the risk factor,
Mm-hmm.
them not knowing, and it's not men's fault. We never got taught how to be vulnerable. We never got
Mm-hmm.
taught how to do this stuff.
And some of the symptoms for audience sake. So I'm sure a lot of people will be watching that show again and again. So
Yeah,
for some of the symptoms, will kind of tabulate for them. So
yeah,
if you feel that your heart is racing, your muscles are tense, and then you're feeling restless and unknown
yeah,
agitation, and
yeah,
also you have sleep issues, and you feel something unknown is going to happen, right?
yeah,
uh,
yeah,
so I think many people will just kind of come to me and say, these don't happen till they try to fall asleep, all of a
yeah,
sudden.
yeah.
So
A
I'm
lot,
sure.
a lot of common symptoms that I went through as well, and a lot of the people I help experience this is, well, actually, there's so many symptoms, but yeah, one is sleeping, obviously, because you're overthinking. Anxiety, as anyone with anxiety who's experienced anxiety knows, that they just constantly worry and think and ruminate, and most likely it comes out when you're trying to sleep, because when you
Yeah.
sleep, that's when everything's quiet. Because during the day, when you've got anxiety, if you've got work or you got to look after the kids, at least you've got something to distract you. But when you try to go to sleep, that's when all the worry, you can't escape it. And that's when
Mm,
a lot of men and females start
mm,
to realize something's wrong. So obviously sleep is a big sign that, okay,
mm,
something's going on here.
mm,
Another symptom is heart palpitations and having a fast heart.
mm,
And another one is feeling like you're out of your body, feeling like you're like not connected to your body, not connected to the world. That's another symptom as well. That's kind of depersonalization. That's a bit of an extreme um, anxiety.
mm,
Feeling disconnected from others, feeling like you can't
mm.
relate, or it really depends on the anxiety someone has too, because you can have social anxiety, you can have health anxiety, you can have
Yeah.
general anxiety, but there's so many symptoms and signs that you might be experiencing it.
Okay. And one important one, a lot of people ask me, and this always happen also to a lot of young folks. I mean, when they have anxiety, they'll say, they're forgetting things. They can't concentrate, and they ask me, did we develop dementia or something? So you're too young to
Yeah,
have
yeah,
dementia.
yeah. I get that. And what I teach people obviously is, and you would know this, when you're in anxiety, your nervous system is in fight or flight. Okay,
Yeah.
so if you're anxious, you're worrying about the future. Okay, or you might be worrying about the past, and you're worrying about the past happening in the future again. Whatever it is, you're out of the present moment, and you're freaking out about either the past or the future, and your body is getting ready to fight or flight.
Mm-hmm.
Now, your body, if you're in fight or flight, your body isn't designed to remember things or be logical. It's in survival mode. So
Mm-hmm.
when you're anxious, it's natural to forget things. When I get if I get ever get anxiety, because sometimes I do, I'm human,
Yeah.
I'll I'll forget things too. And
Mm-hmm.
it's nothing. You're not getting dementia. It's just that your brain and body are getting ready to run from a tiger, trying to survive, and it doesn't need that blood in that bit of the brain to remember things at that moment.
Yeah, and that is the important concept. We call it, pseudo dementia. Where you could
Mm.
have false diagnosis, or kind of thinking that you might have dementia, actually you don't. And like you said, you go into that fight mode, and the fight mode, when the body is operating, a lot of creativity, thinking, logic, all disappears, because you are just kind of doing your best,
Exactly.
giving your best shot at it. So then,
Exactly.
what about some of the other symptoms which you can have with anxiety, actually, with is associated with depression. So you could have both disorders, and
Yeah.
then
They actually
so I
relate
think.
a lot of the times they relate. I've found they're actually coincide together.
Yeah. So do
Yeah.
you see that more in men or women?
To be honest, both, but men maybe a little bit more. It's a bit more obvious when they start to open up. It's like, oh, okay, they're definitely struggling with anxiety and depression. I know when I've had severe anxiety in the past, I've had it's normally coincided with depression. If you look at anxiety and depression at a nervous system level, it makes complete sense because you've got there's the polyvagal theory, and you've got the three levels, and I won't go too deep into it, but you got the top level, which is you're feeling safe, your nervous system's feeling safe, it's feeling joy, it's feeling connected, and then you drop down when there's a threat, you drop down into fight or flight, and then you can drop down into if you can't fight or run. If you've got a tiger that you can't fight or run, then you can play dead and go into dorsal vagal shutdown, which is you start to numb yourself out and start to slow your body down and numb, because if you get eaten, if you know you're going to get eaten, well, our ancestors knew to shut down our body to stop the pain of being eaten. So that's associated with depression, that dropping down into dorsal vagal shutdown. And it's a perfect, your body is working perfectly when you're depressed or anxious. It's actually not a bad thing. It's just that your nervous system is dropped down into these levels because it's perceiving a life threatening. But instead of it being a real threat in real life, it's actually in your mind. That's the
Mm,
problem these days.
mm. And then people can have also really feeling exhausted and lack of energy, and have and basically they are not have no interest in things, and that can happen. Or they could be some could be mostly with anxiety, will not be able to sleep or have a lot of insomnia to go with it. So
Yeah.
make sure get plenty of hours of sleep. And I mean, I do deal with sleep all the time. So the important concept about insomnia is, with hypervigilance, which is part of insomnia,
Yeah.
as well as anxiety. So there is overlap between those two for sure.
Yeah. Yeah.
I'm sure you are seeing that too, right? So,
Yeah, yeah, and like I always take it back to the physiology of our nervous system, because our nervous system really rules the roost. It really rules us because, like you said, people get very exhausted. At the worst of my anxiety, I was going from hypervigilance and just being full panicked for like hours at a time, and then just falling asleep because I was going between level 2 and 3 of our nervous system, which is fight or flight and then dorsal vagal shutdown, and I was just switching in between these two, and I wasn't ever getting up to safety in my body. And when you're feeling safe, well, that's when you've got creativity and your energy flows. But when you're dropping down into fight or flight because you're perceiving a threat, well, you're
yeah,
going to use up a lot of energy, because we're not, if you look at our ancestors, they weren't supposed to be in fight or flight all the time, because fight or flight's great. It gets us ready to run. It uses a lot of energy. It's like spinning the tires on a car. It uses a lot of energy, but it
yeah.
uses a lot of fuel, right? And
Mm.
that's how you can get very exhausted when you're anxious. And the goal is to try get back into safety. Try to work your body into safety and try to learn some more safety in your body and in your mind. And then you can start to sleep better, and things start to get better from there.
Yeah, and that's true. It consumes a lot of energy, and I always give example like it's like, the car normally usually operates. I mean, all four wheels run, but usually front two wheels or rear two wheels are the driving force. But you don't need four wheels all the time turned on, because
Yeah,
you're not climbing hill all the time. So for normal cruising, you don't need that. So same
exactly.
stand. Yeah. So same stand. So let's try to kind of help others. So what are the support which you see they can get to help with dealing with anxiety?
Well, I did a post on my Facebook that got a lot of attention last night, and
Uh,
it was it was a little bit controversial because I was talking about our system. Now, I'm not against the system. I don't know what it's like in America, but I just think the normal system in Australia, or most likely in America, is when you get anxiety straight away, you think to go to the doctor, which is like yourself, which is, and I'm not against that at all. But what I am against is people thinking that's the only option. Okay, so I like to see people branch out and try some other things, because using just medicine alone isn't that effective all the time. So some things with anxiety, you want to start looking at your nervous system, starting to regulate your nervous system. Okay, so there's plenty of people out there. Now, I'm not against seeing doctors like yourself or doctors at all. I
Mm,
think that they've
mm,
saved a lot of people, and there's a massive
mm,
need for doctors. But being on medications alone all the time, I believe, is a bit ineffective. So going
mm.
to see someone who deals with nervous system regulation, like dealing with the nervous system and all that, can be very good too. Sometimes cognitive work, like psychology, can be great too. It really depends on your anxiety levels and what's really going on. There's no one size fits all, I believe.
Mhm. And that's a good thought that there are few things which everyone can do also. So few one of them is do not use alcohol to calm your anxiety. Yeah.
Absolutely not. Definitely not. Yeah. Try. Please try stay away from drugs. Please try stay away from alcohol. In saying that, I know when someone's like that, it's they feel like that's the only thing they can do to numb the pain. That's why I say, in some cases, like going on medication can be a great thing if you're addicted to drugs or alcohol and you can't get off it to because obviously people do that to numb the pain from the neck down and numb the thoughts. So medications can be good, but long term, I think working with your nervous system and getting your body into safety and dealing with old traumas that made you anxious in the first place is a great place to look long term.
Hmm. And other thing is, a lot of people when they get stressed. So for that, also, I just want to kind of differentiate. There's a difference between stress and anxiety. You can have stresses, but anxiety, we're talking about that some of the symptoms we described. So if you're getting those with stress, then that would constitute from stress to anxiety.
Mm.
So then, and you're having these symptoms recurrent. So other things I've seen is people start smoking. So they when they're
Yep.
stressed, they think, oh, to calm the stress or anxiety down, let's
Yeah,
smoke. But
yeah.
yeah, but that has same sympathetic or stimulation effect, same thing as your smoking. It raises your heart, raises your blood pressure. I don't think
Right.
it's relaxing, right? So.
Right. It makes it, yeah, in short term, it feels good. Having a smoke, it calms down for maybe a minute or two. But then, like you said, the chemicals in there start to mess up all your nervous system and everything gets worse. Same as alcohol, same as drugs, same as, sugary food and all that kind of stuff. It's
Yeah.
good short term. But like I said, long term, you really want to start looking at, all right, how do number one, why am I even getting anxiety? Number two, how do I solve this? And most of the time,
Mm,
anxiety didn't start in this moment. It started normally in childhood from maybe small t traumas like not having emotionally attuned parents who were there to emotionally attune you when you felt unsafe, or you might have big t traumas like sexual abuse or other things that have happened in childhood that are making your amygdala, which is in your brain, remember certain things and trying to avoid things in the future from happening again. So
mm.
it's about going back and finding someone to help you guide you back and start to heal a lot of that stuff in the past that's causing the anxiety in your body in the present moment.
And also just for audience learning, if you have anxiety, of course, you should always rule out if you have other problems such as heart. Some people could have actually problem with the rhythm of the heart, and they could have irregular
Yeah,
heartbeat, and then they might take it or mitral valve problem. They might take it as anxiety or panic attack, but actually they could have both. So
exactly. Yeah.
I had one patient very similar. He used to get a lot of these attacks, and they thought it was a panic attack or anxiety. But one time we did a EKG, and we found has actually atrial fibrillation or as
Yeah, yeah.
very fast heartbeat. So same thing, stands for if you have thyroid problem, hyperthyroidism, Graves' disease, you could have those attacks. So it could be manifestation of some medical issues. So make sure get checked properly.
Definitely
See your
definitely get
doctor.
checked. Yeah, yeah, 100%. A lot of people Yeah, a lot of people don't do that as well. So definitely go see your doctor and see if it is those things.
Mm.
I've dealt with a lot of people with health anxiety, and I had that too, where they went and seen their doctor, nothing was wrong, and it was panic attacks. A lot of the time that happens too. But
Yeah.
in some cases, like you obviously know more than me about that stuff, it could be stuff like that as well.
Yeah, so it's always kind of good to see professional, but I think some of things still everybody should do is like you said, and we emphasize again, just make sure stay away from alcohol, and do not just do Google doctor, because that's not going to help.
Google doctor definitely doesn't help your anxiety.
And also, if you are suicidal or if you have problems getting out of hand, because there could be part of mood disorder, depression, bipolar, and there could be complicated issues. So make sure see professional to get a proper diagnosis, and those are very important concepts here. So finally, any final thoughts you have for our audience?
Yeah, yeah. So definitely what you just said. If you're really struggling with that, go see a doctor straight away. Go, and that's when medications and stuff can be a real handy for people.
Mm.
If you're not, if you just experience anxiety and it's on a scale of 1 to 10, 10 being really bad, one being not too bad, anything up to about a 6, I think there's a lot of things you can do. Number one, just a really easy tip you can start to do: start to regulate your breathing a little bit better, because when you're getting
Yeah.
anxiety, your breathing starts to shorten. Okay, and when your breath shortens, and then your nervous system thinks there's a threat, and when your nervous system thinks there's a threat, your breath gets even shorter. So just start to notice your breathing and extend your exhales. Okay, that's a very simple thing to do, but just that alone, just in for 2 seconds and out for 4 seconds, or in for four, out for six. Just extending that exhale for 5 minutes a day can start to bring your anxiety and your nervous system and calm it down. But that's just a easy tip that anyone can do.
Okay. It was fun knowing you as well as learning from you, anxiety. Thank you, Aaron, and come back again anytime. And
Thank you
this,
very much.
thank you for teaching all of us about importance of some of these symptoms as well as treatment. Thank you, Aaron. Take care.
Thank you very much. Thank you
Take
very
care.
much.
Take care. Bye.